Most people today either know somebody directly or indirectly that's been affected by the opiate epidemic, whether it's a neighbor, whether it's a family member, whether it's a coworker. And we know that the Cape has been hit hardest in the Commonwealth in terms of the number of overdose deaths that have existed. Certainly the governor has started everything on, I think, on the right track in terms of, landmark opiate legislation. Some of the things he took to the National Governors Conference that other states are now emulating our legislation, but there's still a lot more to be done as it relates to that. Some recent statistics that just came out are still troubling. One of those being that over half of the overdose deaths this past year had fentanyl related to them, which is a synthetic type of thing that gets mixed with heroin and other drugs. And so, but Representative Tim Whalen and others, worked on legislation to make trafficking in fentanyl, a felony and a crime. And we need to continue to address those type of things. But it's really going to take a very comprehensive look because it covers so many different areas. I mean, it covers education, treatment, diversion, aftercare, public safety impacts. And so we're going to have to take a very comprehensive approach where I think long-term, hopefully where we go is through education and research, because if we can do the right things to prevent somebody from becoming addicted in the first place, you save all that, pain and agony on the individual and the family and what they go through, but also you save in healthcare costs and public safety costs in that way. So I have some ideas about some legislation, one of those being to expand the amount of treatment offered through health insurance from 14 days to 30 days, and that's still not quite enough, but it's a step in the right direction, as well as also looking at those that take partial fills on their medications. Right now the federal law has been changing to allow that person to go back and get the remainder if they need it. The Massachusetts bill doesn't have that, so it may need a little bit of tweaking as we move forward, as well as looking at other things like the sheriff is doing with Vivitrol and that medication, and helping folks that are getting ready to go back into society and help to make sure those programs are funded as well. So I think there's a number of areas that we can take a look at because it is very high on my priority list to look at that, as well as more treatment beds. We need some of those on Cape Cod. I've talked to a woman that's working with a group on a program, if you will, called ASAPS. It's Addiction Support and Placement Stat, and it's based on a program in Boston. And so I want to talk to them some more. That may be something that would be able to be created here on Cape Cod to help those that are recovering, because we still need to think about them as well as we work on the front end of this issue to prevent it in the first place.
Those are fabulous ideas.
Yeah.
I know Thomas Mielke had a film that he's trying to get into the school system here to help with all that. That's something that...
Was that the Not Yet film?
Yes.
Yeah.
I mean, if you can educate children on exactly what's going to happen, how their lives are never going to be the same again, our kids are smart.
Sure.
They can figure it out if you give them the education and give them the tools to stay.
Because I think they think that they can stay on the outside of it. They can do it a couple times and nothing's going to happen, and that's a myth, that they really can get drawn in right away, even from the first time. And I think that movie points that out.
It does, and I think we've learned a lot about what methods of education work. If you remember when we were growing up, it was scared straight and a very negative approach to a lot of that. I think today it's more, I think, a different approach to the education piece that actually will resonate, because sometimes when you take that negative approach, it almost creates them to think they want to take that risk. And I think we take a different approach now, and I think films like that will help to do that, so that we actually reach the younger people and everybody really. And the other part is research. I mean, I think we have some of the brightest minds in Massachusetts, both medically, educationally. If we can find some through research that certain individuals may be more susceptible to an addiction to opiates than others, then perhaps physicians can then offer non-opiate pain management techniques, so that you prevent, again, that person from being addicted in the first place.